Good afternoon, Unite for Her community. Welcome to our second Ask the Experts for the month of May. And we are in for a really wonderful topic, something that is new in the mental health space that we are bringing to you this month. And we are so thrilled to have one of our own Unite for Her providers imparting her knowledge and expertise in the area of PTSD and trauma. But before we get into that, I want to introduce myself. My name is Erin Pellegrin. I'm our Director of Culinary Nutrition and Education. If you've attended any of our previous education segments, you've likely seen me hosting them. It is truly my pleasure, and we have so much more to come starting in June that I will get to in just a little bit. So for those that are not familiar with our Ask the Experts segment, we are streaming live on Facebook. So if you are tuning in with us, know that you can submit your questions to our expert to be answered during our conversation today. We've received lots of questions already from our community, really thoughtful questions, which we'll get to, but be sure to engage, comment, submit your own questions in our live stream as well. If you're not able to make this segment, or you feel like someone else may be interested in hearing what Dr. Reeder has to share today, know that our segment will be recorded and it will be up in Her library as early as tomorrow. So feel free to come back, give it a re-listen, or share that link to our video library to those that you feel like may be helped by the information that is shared. I think we'll all learn a little something today. I want to give a big thanks first to our education sponsors, because we know every month we're bringing you these really important discussions and topics, and we could not continue to do that without our education sponsors. So our digital education events are presented today by West, Merck, and Daiichi Sankyo, and we have additional support from Lilly, GSK, EO, and Gilead Sciences. So we are so grateful for their continued support in the education space and information sharing overall. It's hard to believe that as of Saturday, it is June, but we are moving forward with our next education events that we have coming up next week. So a little teaser on what you can look forward to. So we're kicking off June with our virtual hangout next Wednesday, starting at 5 p.m. Eastern Time. You can register at the Unite for Her website. You'll see links on social as we promote that out. And we will be focusing on pain management with integrative care. So we know pain management in general is a topic that comes up a lot, but you can utilize a lot of different avenues to assist in that management. So we'll be touching on particularly acupuncture and Reiki. We'll be hearing from two of our providers, Dr. Thomas Burgoon and Dr. Joseph Wang, to help educate us and demonstrate how each of those modalities can be tailored specifically to help with pain management. So if that is something that you are dealing with, certainly join us next Wednesday, 5 p.m. Eastern Time. And then we're hopping into our speaker series on Thursday evening at 6 p.m. Eastern Time. And next month's topic will be BRCA and breast cancer in men. What to know about risk, screening, and treatment. And we will be joined by two experts in this arena, Dr. Kara Maxwell and Dr. Jennifer Zhang from the Basser Center for BRCA at the Perelman Center for Advanced Medicine. And we will be learning all about breast cancer screening and genetic testing in men, breast cancer treatment options that are available, including surgery, and ongoing treatment and hormone therapy options. So really great discussion to be had. We know this isn't something that comes up a lot, but there's a lot of work being done in this space with male breast cancer. So again, if you can't attend any of those, or if you just want to come back and rewatch on your own, all of our education events are recorded and will be in our Her library at uniteforher.org/herlibrary. So with that being said, I want to jump right in because, like I said, we have a really wonderful topic that we are bringing you today. So we're touching on PTSD, including risk recurrence. And we are so thrilled to have one of our Unite for Her providers joining us as our true expert today. So to introduce Dr. Tashina Reeder, she is a renowned author, speaker, licensed therapist, and wellness coach, and a true expert in her field. With a doctorate in couples and family therapy, a master's in social work, and a certification in prolonged exposure trauma therapy, she brings a wealth of knowledge and experience to her practice. As a visionary behind Soul Care Services and manifesting her academy, Dr. Reeder has spent more than 19 years transforming lives. Her comprehensive services not only educate and inform healing, but inspire women to overcome their emotional roadblocks of insecurities and self sabotage. And I love her motto: an empowered soul has no limits. So please join me in welcoming our expert for today, Dr. Tashina Reeder. Dr. Reeder, thank you so much for joining me.
Hi, Erin. Thank you for the warm introduction.
Absolutely. We are so glad to have you. And I do want to say, as I mentioned, she is one of our Unite for Her providers. So anyone that is interested in connecting with her, she is licensed in the state of Pennsylvania. But we'll talk about a little bit about how you could get connected in your area. So, Dr. Reeder, just to jump right in, this whole discussion about trauma, PTSD with diagnosis, after diagnosis, I think one of the things that I know I hear often when I'm connecting with our Unite for Her members is, understanding and addressing that they're feeling this trauma, but it's the question around, will it ever go away? What do you say to that?
That's a great question. I think whenever you experience any life-altering experiences, and when we speak in the lens of trauma, it doesn't necessarily go away because you're left with reminders. So, for
Mhm.
example, when we're dealing with a medical trauma and we have a visible physical disfigurement, there's a daily reminder of what was. And then
Yeah.
you're forced to kind of face this new norm. And so when you're experiencing the trauma, right, we're triggered, we're reminded. And so while it may never go away per se, but you can do things to help ease your emotional response to the triggers, the reminders, the anxiety one may feel of going to the doctors and waiting for results, or feeling a lump, or something you may feel that's strange happening within your body, could be a trigger to have a trauma response. And so to I wouldn't say it wouldn't go away, but we can offer, uh, there's resources to offer wellness services and different types of techniques to help improve coping or develop coping to deal with
Mhm.
such triggers as you embrace the new norm of life after the trauma, as we
Right.
continue to tend to our well-being.
Right.
That's a great question. That's a honest question.
Yeah. Yeah, absolutely. And I'm glad you mentioned sort of that fear or that emotional response with going to the doctor, because we know that whether it's when someone is sort of knee deep in treatment or in the early stage of their diagnosis, or perhaps someone that is dealing with it chronically or with a late stage diagnosis, or even someone that, is just going for follow up. There's a fear around, or an emotional response around, that location or being in that area. Why does that fear of going to the doctor, even if it is years after diagnosis, why does that happen?
That's the trauma, right? So when we talk about trauma, it's an event that you've experienced that created a great deal of stress, that had the
Mm,
capacity of impairing you. I say mind, body, and spirit, right? We're mentally kind of distracted by the news. It's shocking. And so whenever we go to the doctors for a follow-up or for treatment, there's a level of anxiety that comes about because of the known, whether it's been a diagnosis or a pending diagnosis or having to go for a biopsy, the kind of overwhelming fear you may feel of what if, right? We may
right.
find ourselves going down this rabbit hole of thinking of the worst case scenario, going into absolutes. It's
Hmm.
this, it's that, right?
Hmm.
And I
Hmm.
think we experience the trauma, that's something that comes along with that is
So
anxiety that one may feel.
Right. And so for those, so it's not uncommon
It's not
for
uncommon.
someone to have this emotional response. And I think that that's probably important to call out, because sometimes perhaps a person may feel like, why am I feeling this way? I shouldn't feel this way. But it sounds like it's very common to have this experience provoke those emotions.
It's very common, when you've gone through trauma, the fear is there, like, oh gosh, I
Yeah.
have to go through this again. Just the fear
Yeah.
of what has happened. Will this happen again? And so this is kind of this thinking we engage into. So it's very common to have anxiety and fear when going to doctor's appointments. Yeah.
Yeah, I think it's reassuring to hear that, like for someone to know that it's okay to feel that way. It's not unusual. Something isn't wrong if I'm having these emotions. So I think it's good just to call that out. Um, we've had a couple, like I said, some great questions that came in from our community. One question that we had from one of our Unite for Her members, speaking to that visiting of the doctor or going to a medical facility. Um, how I've had breast cancer twice. This person submitted, how can I possibly stop worrying about getting it again? So among those doctor visits or just regular checkups or just with time in general, how can they possibly stop worrying about getting it again?
To be honest, I think the worry will always be there because that's the trauma. And so when we've experienced a diagnosis and then having to go through it again,
Yeah.
and so I think one of the words that was used was awfulizing. We
Yeah.
begin to think of, we kind of lose the ability to think rationally about the outcomes because of the fear of what has happened before. So if
Uh-huh.
it's happened again, you do worry because you don't want to hear bad news. You don't want
Hmm.
to have to go through this again.
Hmm.
Will this go away? And unfortunately, when we begin to find ourselves in that space, we begin to lack coping skills only because of the worry. And so we're kind of thinking of, um, as I said earlier, we may begin to kind of think in absolutes. It's going to be,
Hmm.
I have it again. Or we may generalize, every time I go to the doctor's, this. And unfortunately, sometimes because of the worry can be so great, we may unknowingly um, kind of avoid going to doctor visits because of the fear of news. We
Oh,
may reschedule because of the fear and that kind of panic, if you will, depending on what the news you are fearing. And so this too is also normal. And so I don't know if the worry would go away, but there are things that we can do to lessen the worry. And
yes.
so, for example, there's a technique called stop, which is really a DBT, dialectical behavioral therapy, one of their kind of techniques we use where you kind of have to stop in that moment to kind of gather your thoughts, to breathe, and to just
Mm-hmm.
acknowledge this is what I'm feeling, this is normal, call it what it is, I'm scared,
Mm-hmm.
um, this will happen again. T is just kind of think about, okay, what are my options? What do I need in this moment? Do I need to call someone for support? Do I need to talk to the doctor and ask more questions? Do I need to take a walk and get some air before I actually sit with the doctor? And just observe where you are in that moment, right? Engage
Mm-hmm.
in some mindfulness, some breathing, some breath work to bring yourself to a place of calm, and then proceed mindfully. Because honestly, any diagnosis, medical diagnosis of any kind is stressful, right?
Mm-hmm.
It does bring about this fear. And so we have to really check in with ourselves in the moment when we're going through so we can kind of think in our rational mind of, okay, these are the facts. I'm acknowledging how I'm feeling. I may need some support. May not go to the doctors alone. Bring someone with you to the doctors for that support you may need.
Mm-hmm.
And seek support, outside support, such as a therapist, right? To talk about this fear you're having, this anxiety of going to the doctors and the what ifs that we think about, especially when you've experienced a medical trauma.
Yeah.
Yeah.
I love that. I love that stop technique, that stop coping mechanism. And like you said, one of those questions that came in, how do I stop awfulizing when I have to get follow-up testing after an abnormal finding, that like absolute frame of mind and just sort of following that acronym of to help a person cope through that experience. Would you mind just reiterating the STOP and what they stand for again? Because I think people are going to be writing that down.
So stop. So S stands for just that, to stop. To I always say in that moment when you're stop and breathe. Take a moment to breathe.
Hmm.
Perhaps even in that space, do some mindfulness. Feel your legs, feel your arms. Have a
Hmm.
seat. I also encourage people to have a safety plan. So when you are stopping, I can maybe look through my safety plan of 5 things I can do to bring myself to a place of calm, and then think about what you're feeling. Okay, let me acknowledge what I'm feeling. I'm scared, and that's
Hmm.
normal. I'm worried. That too is normal, right? So we have to begin
Hmm.
to normalize what we're experiencing, because again, when we're worrying, we tend to not think rationally, but we become consumed with the absolutes. It's this
Yeah.
again, or it's that, right? And then you
Yeah.
begin to observe yourself in terms of, what do I need in this moment? Observe how you're feeling. What do I need? Who can I call? What supports do I need? Um, in that, to observe what's happening and then proceed mindfully, meaning, let me think about the facts because I don't have the results yet, right?
Hmm.
So let me
Hmm.
not, we try not to think of the worst, right? Because we don't know. We just know what has happened, but that may not be the case going forward. And acknowledge that that's the fear. So proceed mindfully, breathe, and if you need to tap into your supports, even at that time, do that. So just stop, like, whoo,
Yeah.
ew,
What a
like,
reminder. I think we could use all of that in life in general. I love that.
because you probably can relate to this. Sometimes we have had bad experiences, we can go into a form of panic and thinking all of the
Yeah.
things and all of the things and things and things and more things. And before you know it, you done created a whole different scenario that hasn't happened because of the fear, right?
Yeah. Yeah. Yeah, I love that. And you mentioned a lot of different emotions, and I love that you've just sort of reiterated like it's normal to feel this way. So, with that, what are some of the common reactions to trauma that a person can experience when they're impacted by a cancer or a health diagnosis in general? So, what are some of those common emotions, reactions that someone may come upon?
One of the most common reactions is avoidance. Oh, this almost in a form of
Uh,
denial. Nope.
yeah.
I mean, this, no, because of the shock. I can't believe it. Not me. No, and kind of function as if this is happening. So avoidance, depression happens also when you receive some traumatic news, anxiety, and sometimes we engage in unhealthy behaviors to cope with some of the stress we are experiencing. I'm not condoning, but we have people who smoke cigarettes and they may engage in things or pick up alcohol just to cope and to calm down. These are some common things people do. There may be uh, distracted, unable to sleep
Hmm.
because of the constant worry and thinking of the what is the news.
Hmm.
Another common reaction could be crying. Crying spells you're crying and you're just feeling anxious because you're scared, right?
Hmm.
Fear
Hmm.
is the normal common reaction. So there are lots of different reactions. You could become withdrawn because I just need to be in this space of trying to figure out, trying to digest, if you will,
Hmm.
what I'm now facing. So when you're giving this news, it's shocking. So you're like, whoa, I need a second. I need to figure this out. And that's
Yeah.
also normal and common when you're experiencing something traumatic. Yeah. So there are
Yeah.
various emotions one may experience. And so, yeah, those are just a few.
Just a few. Yeah. Is it normal with those emotions you mentioned, and even ones that you haven't, to sort of flow through them, like and go from feeling withdrawn and then all of a sudden feeling really anxious? So, is it normal for a person for their emotional response to sort of shift with time or change as they move along?
Yeah, To be honest, they're constantly shifting and everyone
Mhm.
experiences it different. So 1 minute you may be feeling upbeat in a positive space, and you're reminded, you get a phone call from the doctor, and now you're in this space of anxiety, then you're
Yeah,
feeling depressed, then you're, back to crying. So it can happen, various emotions at various times. So it's
got it.
I cannot say you only experience one feeling at one moment. You may feel this way at one point, but then you can also feel a variation of emotions, and that's normal too. Because what
Yeah.
happens is that we're thinking. And so what we're thinking, we're trying to process and understand. So you're going through various emotions when you're thinking of something, especially when it comes to your health. My life, my family, the children. How am I going to tell them? I look different. Well, am I still attractive? All
Hmm.
things. How I'm going to explain this to my child, or who noticed the change. How can I accept myself? I look different. And so you're constantly in this space of responding emotionally when you're trying to kind of digest and just kind of work through the trauma.
Hmm. Wow. Amazing. We had a great question that came in from our Facebook community. I find myself anxious about other medical appointments like the dentist, so not even related to their cancer diagnosis. Is this normal? Great question.
That's a great question. It's a possibility because of what may have happened before. So you may get to a place where any appointment to the doctors, you may fear bad news. Um,
Hmm.
what if this I've experienced this and heard this in my work, where you may have experienced a trauma in one medical area and think, oh, what if this caused this? Or this is this related? Or just the sheer fear of having to go to a doctor again and hearing something else.
Yeah,
And so I want to say it's common, I don't know if everyone experienced that, but there are folks who may really become a bit anxious about just going to the doctors in general because of what they have experienced with some bad news. Um,
absolutely. Yeah, you bring up some really good reasons why, just sort of that crossover, that fear. Yeah, really great points.
yeah.
Wonderful. Okay. In terms of treatment, we had a question that came in, but also I was curious. So, um, one of our community members submitted what type of therapy is best suited for medical trauma of ongoing cancer treatment. This person has done EMDR in the past. I'm also curious, Dr. Reeder, if trauma can be treated with medication.
Well, that's a great question. I've heard that, I've been asked that before. And so
Hmm.
oftentimes, so let me start with the first question in terms of different types of treatment. And so you have various evidence-based therapies that are available to individuals who've experienced trauma, such as CBT, cognitive behavioral therapy. You have exposure therapy. You have narrative therapy. And these are some therapies that really help you to retell your story, to help you better understand how your trauma has impacted you, has affected you, but also how it shows up in your relationships, and helping you to retell your story to better manage and normalize what you're experiencing.
Hmm.
Now, as far as medications to treat the trauma is merely an emotional response. So what you're really treating is a kind of not behavior, but something that spun out of the trauma, like depression or
Got it.
anxiety. So we may treat those things to help you cope and to kind of live. And what I mean by live, but it's probably just kind of engage in your adult daily living skills, because depending on what you've experienced, it can be so debilitating that we
Yeah.
can't function. So we may need the support of medication to deal with the depression and the anxiety. And so that would be at the discretion of your doctor when you go see the doctor, or to your therapist, who may say, hey, let's consider this, right?
Hmm.
And maybe recommend you to a psychiatrist or a psychologist to then get that uh, treatment to help you kind of function, if you will, while
Hmm.
you're going through. Because the reality is, any medical diagnosis kick rocks, right? But we still have to live. We still have to, some of us has to work. We have children. We're married. We have all the things that we do, right? So we still have to function. And so I'm an advocate for therapy. I'm an advocate for those who feel they need the medication to deal with the experience of trauma that brought about the depression or the anxiety. And so,
Hmm.
and going to therapy, and I always say this to folks, I've heard this often. I don't like to go to therapy because it brings up all of this stuff. Well, yeah, right. And I understand because it's painful to think about or to talk about, which is
Yeah.
why we avoid, right? And
Yeah.
so I always encourage people, even while going to therapy, if you're taking medication, it should go hand in hand with therapy. But also when you're not in therapy, engage in giving yourself some grace and self-compassion because you're just going through a hard thing, right?
Hmm.
Was
Hmm.
it challenging experiences? So, engage in some self-care, some self-love. We've heard those, concepts coined often, but it's truth to that when you're going through treatment in addition to using medication to assist in the process.
Yeah, wonderful. And we do have really great providers that you can connect with, that our community can connect with, including Dr. Reeder, to help you, especially with, some of those coping skills, the cognitive behavioral therapy, EMDR, like some of those different proven therapies that can
Mhm.
really help someone work through those emotions and that trauma for sure. So I love that. Okay. Um, so, sort of shifting focus a little bit to the family
Mhm.
and those that are around someone with a cancer diagnosis or health diagnosis. How does someone support their family if they've been traumatized by, my cancer diagnosis or my health illness? What can we do in that regard?
That's a great question.
Yeah.
Because I believe that both the individual experiencing the trauma and the family are equally suffering, meaning
Hmm.
family may feel helpless. I don't know how to help. They may feel a bit of anger that I can't take it away from you, right? I believe that as caregivers, it's important for us to also receive some support. There's various support groups. There's family therapy that's available to address the medical trauma or things that has kind of became a part of the dynamic of the thing within the system.
Hmm.
So to address as a family because the truth is told, everyone's hurting, everyone's probably scared, but don't know how to vocalize it. So I'm trying I want to present as strong, but really but terrified just as much as the person having to endure this illness. And so I think communication is important, although hard. 'Cause we don't always have the words to express how we feel, and we don't always know how to hear,
Yeah.
respond. And so I think with caregivers and families, I really believe family therapy will be definitely helpful in the process of just acknowledging, addressing, and learning how to support each other through it. Um, and having conversation with the doctor as a family, like how can I support my wife, or how can I support my child, or how can I support while going through this? Um, Maybe you need, as a family, create a support system, right? That we can maybe tag team with each other so that the person going through it won't feel um, that there's a lack of help, but they also won't feel um, overwhelmed by all of the support. I hear that a lot too with people. Oh, they're always hovering over me. I'm like, well, they love you. They're
Yeah.
there,
Yeah.
right? And
Yeah.
so it's important to help both family and the individual to understand and hear and understand the experiences. It's a
Yeah.
process. It doesn't, it's kind of a lifelong experience. You will always remember, but we can turn this into a space where it can become our superpower of how we can help each other through it.
Yeah. I
And
love
find
that.
the
I
silver lining.
love that perspective. Yeah, I love that perspective. Um, so in terms of support and those around us, we had a question that came in on Facebook. In her 2 years since her diagnosis, this person has lost two of their survivor cohorts. It's been, she said, huge triggers that reactivate her PTSD It makes her fearful to expand her network of survivors. Are there ways to handle this other than social avoidance?
Yeah, that's a tough one. Because what they're speaking to is grief. Now
Ah,
I'm dealing
yeah,
with I done lost my support group, right? So now I'm
yeah,
dealing with these stages, right? If you will, the the the, the sadness of it all, right? Who can I connect to? I lost two. Um, Maybe they become develop a fear of connecting again out of a fear of losing that circle. And
yeah.
so my um kind of my suggestion would be one to engage in therapy, to receive some individual therapy to work through that. And I think with loss, to also maybe do some grief work because it's still a form of loss. It was an attachment that
Mm,
was created and it was lost. And so to acknowledge that as a loss, and how can I recreate a system where I can feel supported, right? And normalizing that process.
mm.
So I think there's a combination of here of trying to restructure the support and what is needed and acknowledge it as grief because that's what has happened in that regard.
Wow, great observation. Great observation. And another question that came in, which I also love this, going back to the family support dynamic, because we also know that bringing up that conversation of asking our caregivers to attend a support group isn't always the easiest or the most conversation to have. So, how do you talk to your caregivers about attending a support group or therapy? Any tips on how to have that conversation, Dr. Reeder?
Mhm. So that's a great question because we all are doing things and our time is limited, right?
Yeah.
Especially if there's kids involved. And so what I would recommend is one, kind of having a conversation with each other of what is it that we need to to support us, right? Um if maybe ask questions is if we had the time, what type of support would be helpful? Or sitting down together and allowing each other to feel as if they have equal parts in this process in terms of deciding care for the family. Um,
Hmm.
what a collaborative type of work of let's find some resources together and then together we can identify what would best suit our needs based on our time constraints, um, uh, things that realistically that we can actually engage in, or even it could be asking for an appointment with the doctors and maybe them offering suggestions in terms of support and what what's available to them. So I think
Hmm.
make it a creative process as a family because it could be it's hard as a family trying to uh, go to support groups or any type of support as a family, we don't always understand the importance, because we're not always told. It happens all of a sudden. The family
Yeah.
is also traumatized too. So it's like it's
Yeah.
all new. It's new territory. So we have to figure this out together and maybe coin it as that. This is a new adventure for us all because it is an adventure, right?
Right.
And what do we need? And maybe even being transparent with each other. Are you scared? Because I'm scared. Are you
Yeah.
worried? I'm worried too.
Yeah.
That way you can just normalize it so they feel like, oh, yeah,
It's
because
not just me.
right.
Right.
Exactly.
I love that. And I would imagine, so another question that came in was just around this person's husband, history of depression. Are there support groups online for spouses, for caregivers specifically? So are they available for different populations of people depending on, what their role is in the household or in a given relationship?
I imagine so. I don't know if any off like at currently to kind of speak to, but I do believe because of the world we live in now, there's more than likely a lot of virtual programming that's offered for spouses, for caretakers. It would just be a matter of trying to find that resource. So I don't know any of any specifically, but I do believe that they're out there. Yeah.
Yeah. Yeah, I'm sure. Okay. Wonderful. So something else that I have often heard from our members, especially because what I have found is, they may be the center of the household, the person that sort of manages everything. So one thing that we often hear, I often reject help as it makes me feel helpless. Does this behavior or attitude stem from trauma?
I think it's a combination of both.
Mhm.
I find that those of us who are very independent, we were the go-to person. We were kind of uh the ones who kind of kept it together as a family. We were the ones that, uh the point person.
Mhm.
I
Mhm.
find that one, there is a level of control needed. And so if I don't have this control, it's a little scary.
Yeah.
And so I don't want to feel like I am unable because of my illness. I don't want to feel like I'm losing myself because of this illness. So I'm going to reject the help. I don't, it's not intentional. I think this is a way of them still feeling independent and feeling
Mhm.
that I'm not losing my abilities. But then on the other hand, there's a reality of I really do need to help because I'm in pain. I really do need the support because I don't know what this will look like after a surgery.
Yeah.
But then, unfortunately, sometimes our pride gets in the way. We're unable to ask for the help. We don't know how to allow help to help. So it's a combination of just some control there, the need to
Mhm.
control the narrative, but also some fear of not wanting to feel like I'm unable or I'm losing my abilities or I'm losing the person who I am known to be, the strong
Yeah.
one, the independent one, the go-to. It's still all those things. You just need a little help, right? And to acknowledge
Yeah.
it that versus it being seen as um um
A weakness or something.
right.
Yeah.
Yeah, thank
Yeah.
you. Yeah. Yeah.
I love the way that you put that. You're still that's still a part of you. Those attributes that make you, you're still them. You
Yeah.
just need a little bit more support. I love that.
Yeah. Yeah. I heard that a lot, actually. Yeah.
Yeah, I'm sure. Um, in terms of, again, sort of shifting a little bit, with our members at Unite for Her, surgical treatments are something that can be quite life changing, physically, emotionally. So, for those that are looking to work through their trauma, but are reminded daily of their scars as a result of mastectomy, surgeries, hysterectomy, how do they work through that emotion when they have those constant reminders, or they're looking at that new reflection of themselves in the mirror every day? It's
Aaron,
hard.
that's a loaded question.
Right? I'm just like, it's so hard.
Um, because you have a daily reminder,
Yeah.
and there isn't an easy answer, but to one, give yourself, like I said earlier, give yourself some grace. You've just been through something really traumatic.
Yeah.
I believe as women, when we have mastectomies or a lipectomy, disfigurement, or we um, have to have a hysterectomy or any type of surgery to our lady parts, it changes our sense of self. And so when we're looking at this new version of ourselves, I always tell my ladies, let's not look at that in a bad space, but redefine yourself of who you've always been. I think we have to get into this space of empowering ourselves even through um the mucky stuff, and acknowledge
Mhm.
it as that like I'm uncomfortable with how I look. I miss my breast. And sometimes even exposing yourself and looking at what's beautiful about me. Because when you have experienced trauma, it has a way of altering how you see your reality. So what happens is you'll become hyper focused on the loss of the breast or the loss of what once was.
Right.
And so again, it's another form of loss. You're grieving.
Yeah.
I'm
Yeah.
grieving the loss of my breast. Oh gosh, I don't feel sexy. I don't feel attractive. My clothes don't fit the same. And so you have all of these questions that really impact your self-esteem and your confidence. And
Mhm.
so starting from a place of this acknowledging yourself, I know that we do exposure kind of activities of mirror work, and it's hard. So we do increments of maybe for 3 minutes, stand in front of a mirror, maybe
Mhm.
holding what I guess the places where your scars are. And this
Wow.
honestly reflect on what is it you see. And think about the beauty that is still present, and even like having them list the distortions because they'll say things like, "Oh, I'm unattractive," or "I," well, were you attracted? Was that the case before? And oftentimes is a no. It's because of the change. Let's talk about that because
Yeah.
and so we do a lot of kind of narrative work, helping them to retell their story and talk about how that trauma has show how it affects their reality. And so I think
Wow.
it's a hard answer because everyone's different in how they choose to accept. And it's a process. It doesn't happen overnight. Some women are very bold and it is what it is, and some of us are not. It's like,
Yeah.
whoa, this is a lot. And so
Yeah.
give yourself grace, self-compassion, love on yourself, even in the midst of the tears, because you cry, you will become angry. You're grieving. Again, it's a form of loss. So acknowledging that as that, and even engage in some therapy.
I love that.
Right.
Wow.
I believe at some point there will grow to be acceptance because now with in breast surgery, you have reconstruction surgery where you can have breast again. I mean, of course, it's not the breast you had originally, but it's learning how to redefine myself
Yeah.
with my new norm
Yeah.
and pointing
I love
out the positives that has always existed within you.
Yeah. That reframing, I think, is a reminder that's good for all of us, just sort of changing that perspective, but no doubt not easy.
Not easy.
I know we have a few minutes left. I want to make sure we cover a few more things. So, in that same conversation around sort of the physical triggers, Dr. Reeder, do you have some suggestions for what someone can do when they're feeling triggered with shame or anxiety when they're around their spouse or their partner?
Yeah, that shame is a powerful thing. Sometimes when we've experienced such traumas, we condition ourselves to kind of almost give power to the shame. And so, what I always suggest to my ladies is, in your marriage or in, in that relationship, counseling. You have couples counseling, to talk about those things. And then even depending on how your relationship is with your spouse, if you're at a space where you can openly talk about how you're feeling, being vulnerable is also uncomfortable because it's different. And so
Yeah.
I think in that space as women, we may fear feeling rejected. And so we may be kind of hesitant to talk to our spouse. But I think in a marriage, sometimes being uncomfortable is where I say the magic happens because you begin to acknowledge um, some things that's difficult and you get to hear from both parties and be honest. I think
Yeah.
be honest with how you're feeling and that spouse can be honest with you, your partner, and talk about what does this mean now? Do and be honest. Do you still find me attractive? Do you still
Hmm.
find me sexy?
Hmm.
I don't feel sexy, and here, so I think it's just having an honest conversation coupled with, I believe couples therapy will actually be helpful too for the couples dealing with.
Yeah. Yeah. Absolutely. Um, just a couple last minutes. So we had a great question because in the space of mental health providers, there's a lot of different experts and professionals that are out there. So one question that came in on Facebook: 14 months into my diagnosis and treatment, now ready for counseling. Should this person see a psychologist, a psychiatrist, a licensed counselor, social worker? Um, what is your recommendation in terms of where to start?
Um, I I believe that, when you're dealing with mental health, seeing a psychologist will deal with the mental aspect and can kind of talk about medication, treatment for medication to treat depression or things like that. I always
Okay.
go with the therapist. I think as therapists, we have, depending on the discipline, kind of a wealth of training to address various, issues around trauma, mental health, and things like that. Do your research though. Ask lots of questions. See if the therapist you're looking at, if you choose to go to a psychiatrist because you believe you need that's fine too, but do your research and see, look at the research their background. And do they have experience in working with individuals who've experienced trauma. How long have they been treating? What are some of the reviews? Things like that. So I think it's important. And also, if you do find a therapist, or if you choose the route of a psychologist or psychiatrist, I always tell my ladies who I work with, it's okay to say this may not work and find another person who's a better fit. I
Right.
always also suggest seek those who offer consultations, free consultations, to kind of have a discussion to see if this is going to be a good fit.
Mhm.
Because you should be able to make an informed decision about your health. So I believe it depends on what that individual is seeking, would determine if they choose to see just a therapist or someone who can also provide uh, uh, medication, treatment, therapies to address, what their needs are. So, but do the homework, do the research, and make that decision, an informed decision.
Mhm.
To meet.
I love that. And I love that you mentioned also it's okay to like not have a match the first time around or the second time around. Keep looking. There's someone out there that you can connect with and feel like you can build that trusting relationship with for sure. And then one last question, if I can just pick your brain for one more moment, because this is a great question that came in. We've talked about recurrence and diagnoses, but survivor's guilt.
Mm,
Being in remission, is that a form of PTSD, of trauma?
survivor's guilt. So let me make sure I understand your question. Are you asking survivor's guilt a form of PTSD? Is that the question?
Yeah, is survivor's guilt, being in remission, a form of PTSD?
Well, typically, when I think of post-traumatic stress disorder, that tells me that the experience that you've had, the result of that is still impacting your ability to function, post 30 days from the event. So when we
Hmm.
talk about survivor's guilt, I believe it can contribute to that, because depending on what the trauma um, has occurred, you can be thinking, why did I survive? Why, these why questions. Um,
Right.
or especially if it's family, oh, all of them, and why didn't it happen to me? So you begin to kind of feel bad about surviving, which is still tied into the grief and loss, and then the trauma of it all. So I believe it can relate to each other. Having a survivor,
Wow.
kind of thinking about just the loss. 'Cause I think any medical diagnosis such as cancer is traumatic in of itself. And so if you have people you've known and loved who passed, who transitioned as a result, but you didn't, you
Right.
can develop, oh, I can't function because I feel bad for living and enjoying life. I should this doesn't feel fair.
Yeah.
Um, they were so young, it should have been me. All of these things you begin to think. So I think absolutely it could can contribute to PTSD.
Wow. Wonderful. Oh my gosh, Dr. Reeder, I could sit here and talk with you for another hour, but I know you are busy. So thank you so much for your time. Thank you to our community for submitting all of your questions here on Facebook ahead of time. Clearly, we have an expert among our providers in this space. So again, Dr. Reeder is a provider on our Unite for Her network. If you're in the state of Pennsylvania, you can connect with her. Um, and we'll put your email in the chat for those that are interested in connecting. But thank you so much for spending some time with us and giving us some things to think about moving forward. We are so appreciative for you.
Thank you for having me. I enjoyed this time with you.
This is wonderful. And I think, as a little teaser, we will have you back later this year for a little bit of a more interactive experience. So be on the lookout this fall for another event with Dr. Reeder. But until then, thank you so much for being here. We appreciate your time.
Thank you.
You're welcome. All right. So with that, um, I want to thank all of you for tuning in. We had great questions. So, again, if you want to come back and re listen, Dr. Reeder shared so much information. This will be on her library, so you can come back and review that, of course. Remember, we have our virtual hangout next Wednesday. We're talking about pain management. specifically utilizing acupuncture and Reiki. So join us next Wednesday, 5 p.m. Eastern Time. And also Thursday for our speaker series, 6 p.m. Eastern Time, BRCA and breast cancer in men. So we've got two physician experts from the Vassar Center for BRCA at the Perelman Center for Advanced Medicine. They'll be joining us as well. So hopefully I will see you there. One last thanks to our education sponsors. So today's Ask the Expert was presented by West, Merck, and Daiichi Sankyo, with additional support from Lilly, GSK, EO, and Gilead Sciences. So hopefully I will see all of you next week for our June education events. Thanks so much for joining us, and have a great afternoon and a wonderful weekend ahead.